Well, guys, can you believe that this is our final podcast for Nursing 151? And what a great topic. Sexually transmitted infections, or STIs. You might also have heard them referred to as sexually transmitted diseases, or STDs. This has changed recently in the past to STI. STIs is a major health concern worldwide and is addressed very well in Healthy People 2020. And we've talked about Healthy People 2020 a couple times in the past. There is a link on D2L to the website, so feel free, and it's highly recommended that you check that out. There are varying objectives, and they refer to eliminate sustained domestic transmission of both primary and secondary syphilis, reduce the proportion of females who have ever required treatment for PID. Those are two main focuses of Healthy People 2020 regarding STDs in the U.S. The way that they plan on doing this is to teach sexually active clients to protect themselves during intercourse. The lowest risk of this disease is either with abstinence or a long-term monogamous relationship with someone free of infection. They also are planning on teaching patients how and when to use condoms, educate about complications of STDs or STIs and PID, target ethnic minority groups for education, as they often have the highest incidence of both STDs and PID, which we'll talk about in a little bit. Target substance abusers as well for both education and screening, along with because they also have a very high incidence of the disease. We, according to Healthy People 2020, it's going to be very important for healthcare professionals to participate in health fairs in order to screen at-risk groups and provide culturally appropriate educational materials, both written and orally. And it's going to be very important to keep that at a fourth grade literacy level so that is easily understood. Sexual issues surrounded by controversy in the U.S., the next topic here. Americans hold strongly to autonomy, whether it's a sexual activity, with whom, appropriate behavior, all of that, as a high value. Confidentiality protects this principle in some clinical situations and under some state laws. We need, as nurses, to respect autonomy about sexual decision-making and confidentiality. And, that's really important, especially as we're going out and having educational sessions and, offering our services for public health, because through this we're able to better educate and protect communities regarding these different STIs. Clients, there are many issues that can affect the community regarding STIs. And some of the major ones are clients who refuse to discuss STDs with their partner or STIs, those who choose not to get tested or treated, can pose a really big challenge as the number of STIs continue to increase throughout the world, not only the U.S. And this is occurring even with improved diagnostics and treatment and public knowledge about diseases. So with all these things, we need to keep these in mind. This is really important information to keep in mind as we learn about STIs over the next couple minutes. The Health Department and CDC, diseases that are reportable to local health authorities in every state include chlamydia, gonorrhea, syphilis, and AIDS. And there are specific forms that must be filled out if anyone is diagnosed with any of those diseases that have to be sent into the state. And just so you guys know, on D2L, I also posted the CDC handout for each of the diseases that we're going to talk about today. So that's another resource for you guys to use. So syphilis can also, it's acquired as a sexually transmitted infection, but it also can be acquired congenitally by the placenta. If the mom is exposed during sexual contact or contact with open sores, a fetus can be infected as well, and this can lead to really serious complications and even death. Syphilis is divided into a primary stage early stage and later stages. So the primary stage, people usually develop a canker or a painless ulcer, and that appears at the site where the organism entered the body, usually about 10 to 90 days after exposure. This is when someone is highly infectious. Symptoms can also include fever, weight loss, malaise. The canker is usually present for about 4 weeks and disappears. So the person might think, hey, I'm doing good. I didn't need to get treated. Things are great. But the organism is continuing to spread throughout their body and they're still infectious. The second stage will occur 6 weeks to 6 months after the first skin eruption. And the patient can at this time develop wart-like plaques that are also infectious on their genitalia. At this point, syphilis is now a systemic disease. These patients often exhibit malaise, they might have a fever, headache, muscle aches, sore throat, and they might even get a rash on their palms and on the bottom of their feet. So as syphilis continues and is untreated, it can actually cause people to develop damage to their brains, and this can cause confusion, alteration in judgment, and that sort of behavior. The diagnosis is done by titers, which is a blood drawn, or they are also, it can be screened initially as a culture. Treatment really depends if what stage the person's in, if it's early or late. 2.4. So the treatment usually consists of penicillin in a single dose or a longer duration if necessary. So that is a really important part of the treatment, the antibiotics. That's the only thing that is going to treat syphilis. There are a lot of people that are allergic to penicillin. If they are allergic to it, they can either have a course of doxycycline or tetracycline. Can also be treatments of choice. And here is just a description of an open sore or canker that is caused by syphilis. Chlamydia is the next disease that we're going to talk about. Chlamydia is caused by Chlamydia trachomatis, and chlamydia is the most common STD in the United States, or STI, sorry. It occurs very frequently in sexually active adolescents and young adults. The incubation is usually about 1 to 3 weeks, but symptoms may be present for months. The organism might be present for months without producing any symptoms, and people are often asymptomatic with chlamydia. The average infection before diagnosis is about 1 year for women and 5 months for men. So these people are infectious the whole time that they are asymptomatic. So some symptoms that men might get might be urethritis with dysuria or painful urination. They might have frequent urination. They might notice some like a mucousy discharge when they're urinating. If chlamydia goes untreated in men, it can actually cause prostatitis or an inflammation of their prostate, and can lead to infertility as well. Some symptoms that women might exhibit, as again, up to 70% of women are asymptomatic with chlamydia, but if it is present, they might have like a thin or purulent discharge. The cervix will bleed easily during their examination. That term is called friable, so that's what that means up there. Their cervix bleeds easily. They might complain of urinary burning and frequency. They might have lower abdominal pain. Because so many people are asymptomatic, the CDC has recommended that screening is the primary method of decreasing the disease incidence. So all sexually active adolescent female from ages 20 to 25, women greater than 25 that are at a high risk, and also all prenatal visits. The screening will include a test for chlamydia. Really quick, if a baby is exposed to chlamydia in the birth canal during birth, the baby might develop conjunctivitis from it and also can develop chlamydial pneumonia. Treatment of chlamydia can include, the diagnosis really quickly is, again, just done by a culture of the cervix. Or in males, they'll do a culture of the urethra. Treatment includes the testing of sexual partners and subsequent treatment. The couple should refrain from any sexual activity for 7 days after taking a single dose of the antibiotics, or if it's a 7-day dose, they need to refrain from sexual activity the entire time. Usually people are treated with doxycycline or azithromycin or Zithromax, and if a woman is pregnant, then it would be Zithromax or amoxicillin. Many times they'll do a repeat culture 3 weeks after the completion of the antibiotics just to make sure that they were effective. Education is going to be really important regarding the transmission of this disease. So the mode of transmission, incubation, symptoms, treatments, abstinence, it's going to be really important to make sure the patient understands that they need to follow up immediately if their symptoms recur. They might develop complications such as PID and ectopic pregnancy or infertility for women. And again, men might have fertility issues as well because of this disease. Again, for chlamydia, annual screening is recommended for all of the following groups. And this is a really important point to educate people about. All sexually active adolescent females and women ages 20 to 25, even if they are asymptomatic. Women over 25 who are at a higher risk for obtaining chlamydia, and also pregnant women need to be screened as well, at least at their first exam. Gonorrhea is the next joy that we're going to talk about. Gonorrhea is caused by Neisseria gonorrhea. There are approximately 600,000 new cases every year, and gonorrhea can be very difficult to diagnose. It is symptomatic in men, but many women are asymptomatic with this disease. And again, a culture is going to be the primary way to diagnose this. Most common symptoms of gonorrhea include a purulent greenish vaginal discharge, dysuria or painful urination, urinary frequency, and the female patient might complain of the development of vulvar inflammation, and they might also complain of either pelvic and or abdominal pain. But again, up to 50% of women are asymptomatic with gonorrhea. So a lot of times they'll do a culture for chlamydia and gonorrhea at the same time, and it's most often the same target group that we were just talking about that will be tested. Again, it's very important to do a cervical culture during an initial prenatal exam. They will do it again on people that are at more high risk, those populations. Many times, people are infected with both gonorrhea and chlamydia. And again, they can both be asymptomatic. So it is really important to give good patient education regarding screening and the need for it. The education for gonorrhea is going to be very similar to chlamydia, related to how this disease is shared. And it's going to be really important. And I didn't say this yet, but with any STIs, it is really important to assure our patients that we're going to be confidential of their medical records, because many times they feel really guilty and full of shame about these diagnoses. So it's really important to address this and not to increase these feelings, because otherwise there's a good chance that they're not going to get the treatment that they need. Both partners need to be treated for gonorrhea, and definitely we need to educate our patients to return for any follow-up if the symptoms should recur. Trichomonas is the next STI that we're going to talk about. Many people will just refer to this as trick, so if you hear somebody saying trick, that's what they're talking about. Trichomonas is caused by Trichomonas vaginalis, and it is a microscopic motile protozoan. Do any of you remember what that is from biology or microbiology? They're tiny little organisms. That's all. We'll leave it there. But motile means that they can move. Many times with trichomonas, people can be asymptomatic, but if they do have symptoms, they will complain of a yellow-green frothy discharge that is very odorous. Sometimes they'll complain about a vaginal or vulvar itching. They might also complain of dysuria and dyspareunia. When they're having their internal examination done, their cervix will appear a strawberry red color, so it'll be bright red. And again, the treatment for trichomonas is actually flagyl or metronidazole. And again, it's very important education-wise that both partners be treated. Here on the top left is a picture of trichomonas, and you can see the little fishtail at the end. Here we go. So this right here is how the trichomonas moves. All right, so it'll propel itself forward with that little fishtail. And here is a strawberry red inflamed cervix that of a person that's been diagnosed with trichomonas. HIV and AIDS, you're going to get this in your education further, so we're not going to dwell on HIV and AIDS because it's such an in-depth topic, but I at least wanted to talk about it a little bit because it is a sexually transmitted infection. That's one of the ways that this disease can be transmitted. So HIV and AIDS are transmitted, the organism is the human immunodeficiency virus. And just so you know, at the end of 2010, there were 1.1 million cases of HIV, and 1 in 6 people do not know that they are infected. That is very dangerous because they are infecting other people without even knowing it. So HIV, the virus, can survive in blood, semen, vaginal fluid, and breast milk. And this organism will cause a defect in the natural immunity against diseases. So people who have HIV, especially AIDS, the last stage of it, which we'll talk about in a couple minutes, are really at risk for serious illnesses. HIV and AIDS were first seen in the US in 1978. And I'm not going to get into the whole big explanation of it, but it is called, the virus will actually infect T cells in the immune system, and it can directly affect the brain T cells, which are needed to defend against pathogens. T cells, if you want to remember it this way, are like the master immune cells. So the HIV virus affects these T cells and will inhibit the body's ability to protect itself, the immunologic protection. So it causes immunosuppression and will affect the patient's ability to fight disease. Again, it's transmitted through what? It's right there. Blood, semen, vaginal secretions, breast milk. All right. HIV-infected patients are at a greater risk for other STDs, so that's an important thing to keep in mind when you're doing patient education. People who are at a higher risk for HIV include those who have any anal sex, shared needles, unprotected sex with multiple partners, unprotected sex with partners who are infected with HIV, hemophilia or other clotting disorders, patients who were given untested blood products before 1985, healthcare workers, sorry guys, and sexual partners of anyone that is at risk. So these are all examples of people that are at a higher risk for HIV and AIDS. The treatment varies. Usually people will be on various antiviral agents, and they have had a lot of breakthrough with different antiviral agents using to treat HIV. And just as a side note, really interestingly, you guys can look this up, but in the last couple years, there have been 2 babies that they actually, is that a good teaser for class? We'll see what we can do. Okay, moving on. HIV and AIDS, there are 3 different stages of HIV. The first is the primary infection, and patients during the primary infection will exhibit flu-like symptoms that last for about a month. And they'll develop flu-like symptoms, um, and this will occur after they first become infected. Then they'll go into a clinical latency phase, and this phase can last anywhere from 6 weeks to years. This phase, people will have no symptoms. They'll actually develop antibodies in their blood to HIV. But then, they're at risk for developing AIDS. And AIDS is clinically diagnosed when someone develops an opportunistic infection. And that's the kind of infection that normally healthy people should not develop. Some examples of this are fungal candidiasis of the bronchi or trachea. A couple really important ones to look out for would be some opportunistic cancers, like invasive cervical cancer. Kaposi sarcoma is a type of skin lesion, and Burkitt's lymphoma. Those are all indicative of AIDS. You might also see patients develop a certain type of pneumonia. It's called pneumocystitis carinii, and that is really specifically patients with AIDS that develop that kind of pneumonia. Patients that might develop either viral illnesses or bacterial illnesses, patients with AIDS are at a really high risk of contracting tuberculosis. They might also develop a wasting syndrome eventually as their body starts to shut down, and it can even develop into dementia as well. Sorry about that. So universal precautions are going to be really important when we're taking care of patients that have HIV or AIDS. Again, blood, semen, vaginal secretions, cerebrospinal fluid, any pleural, peritoneal, pericardial, amniotic, or synovial fluid. We need to be careful with all of that. Treatment really quickly, we talked a little bit about it, but they need to be on highly active antiretroviral therapy, or HAART. They are going to be on these suppressive meds for the rest of their life. Usually they're on at least 3 different meds. Some of the common ones that you might hear of are AZT, interferon, are 2 really common ones that they might be on. But these meds will help prevent any opportunistic infections and also treat any symptoms. Some issues with these meds include the cost, patient compliance, and education. So education is going to be a really important part of this, and also using any available resources for patients that have been diagnosed with HIV or AIDS. It's going to be really important to address any reproductive concerns that they had. And again, it's going to be really important to use good universal precautions. It used to be overkill when they were treating patients that had HIV and AIDS. They were put in isolation. That's no longer the case. Just really good precautions, universal precautions, are usually what is done for people with HIV and AIDS. And again, this topic is going to be addressed later. I just wanted to touch it briefly since it is one type of STI and can cause an increased risk for other types of STIs. The next STI that we're going to talk about is HPV, human papillomavirus, or genital warts. There are a couple different strains, and one strain can cause genital warts. The other strain can cause cervical cancer. So, it's really important that patients get tested for HPV. Approximately 20 million people in the U.S. have an acute HPV infection, which makes them infectious. There's an increased risk between this and cervical cancer. And interestingly, there's a vaccine that is now available, Gardasil, and it's the first vaccine that has been made to prevent cervical cancer, precancerous lesions, and warts due to HPV. And there's been actually a lot of controversy in the last couple years about offering this to male patients because obviously male patients are not going to develop cervical cancer, but they can transfer HPV from one partner to another. So they're really going back and forth as to whether or not to allow men, young men, to be given this vaccine. There are over 100 different types of HPVs. About 40 of them can actually infect the genital tract, but most infections are unrecognized because they are asymptomatic. Women sometimes seek medical attention. They might complain of a grayish or pink lesion in the genital area. Sometimes it will be painful or itchy. This can develop about 3 weeks after exposure, but it might not develop until 3 years after exposure, and the average is usually about 3 months. So they can be, again, infectious that whole time that they're not exhibiting any symptoms and they don't know that they have it. The diagnosis is usually made just by a visual comparison. Cervical and genital warts are the most common symptom that patients will complain of. And also biopsies are going to be very important. This is the reason why pap smears are done, is to test for this virus. And colposcopies, that is just the insertion of a colposcope into the vagina so that they can really get a good view of the cervix and also take samples for the biopsy. The CDC doesn't really specify the treatment of choice for warts, but they do recommend that it should be based on client preference. Sorry, I can't talk. And what their available resources are, as well as the experience of the healthcare provider. There are a couple of different solutions that can be used to actually put on the warts to remove them by the healthcare provider. I'm not going to make you learn all of those, but for example, they can either be given meds. Cryotherapy is when they freeze them and take them off, or they can be cut off. If cancer develops, they will need to have a colposcopy. They will probably need to have a hysterectomy. But again, Gardasil immunization protects against a couple different strains of the HPV, and that is offered to young girls now. And again, they're looking at offering it to men as well. So it's going to be really important, again, to educate our patients regarding this disease. You know, the use of condoms can reduce its transmissions. So usually the partner does not need to be treated unless there are large lesions present and they feel that they need to be treated. And here is just some examples of genital warts that are caused by the HPV or human papillomavirus. All right, herpes. Don't worry, guys, we're almost done. So herpes cracks me up because I took virology in college long ago, and my virology professor used to call it the hoips. But anyway, watch out for the hoips. Herpes, the organism that causes it is herpes simplex. And just so you know, there are two different kinds of herpes simplex viruses. Herpes simplex 1 is associated with cold sores. Herpes simplex 2 is the genital herpes. There are two different types of herpes infections, just so you know. So herpes is an acute but recurring, incurable viral illness. Again, cold sores are caused by HSV1. Genital herpes is caused by HSV2. Usually they'll have a primary episode where they will develop blister-like vesicles. And do you guys remember what vesicles look like from your health assessment class? We'll be looking at some pictures in a minute, don't worry. But the vesicles appear within a few days to up to 20 days after the exposure. And it is estimated that more than 45 million people in the U.S. are infected with with genital herpes and have not been diagnosed because they either have mild or unrecognized infections. So you can see with all of these different STIs that we're talking about, people are at a really high risk for contracting these because many times people don't know that they're infected. So anyway, once someone does develop these vesicles, they can often rupture and they form painful lesions that can lead to problems with urination. It might cause the lymph nodes in that area to become swollen, especially near the primary lesion. And so once these lesions heal, the patient will enter a dormant phase. But the disease is going to reside in the nerve ganglia. And so these patients are always at risk for a recurrence. Usually the recurrences are less severe, but again, they can be brought on by stress, menstruation, ovulation, pregnancy, poor health, tight clothing, or overheating. So any of these things can cause someone to have another outbreak of herpes. The diagnosis is usually made again by the clinical appearance of a lesion, but they will always do a smear or a culture. They might do lab work to diagnose herpes because people will develop antibodies in their blood as well. There is no cure for herpes virus. There are many long-term complications. Neonatal transmission is a really high risk, and also a high risk of acquiring HIV. The treatment usually goes along with treating the symptoms. So the goals of any treatment for herpes includes decreasing discomfort from painful lesions, promote healing without secondary infections, decrease viral shedding, and really the prevention of transmission of infection is very important. So antiviral agents, again, are not going to cure herpes, but they're going to decrease the intensity of the symptoms that somebody is having. Here are some examples: acyclovir, valacyclovir, and famciclovir. Are all going to be important antivirals. The most common one I've seen used that we would give out prescriptions for was the acyclovir to treat herpes flare-ups. So again, sometimes patients who have herpes are even put on daily acyclovir if they've had more than 6 outbreaks in a year, just to prevent that from recurring. The cost is very high for these medications, and this is actually a major health problem. They have said that the cost yearly just for herpes is over $207 million, and it accounts for 36 healthcare provider visits and 64% for drug therapy. So that's for that 207 million. So yeah, that's a pretty big chunk of change. But that's not the only issue. Herpes, again, is very easily spread and can be a real issue if people don't know that they're infected. Here are some examples of both HSV1 and HSV2. Okay, so which is HSV1? That would be the cold sore on the mouth. HSV2 would be lesions. For example, this is a lesion on a penis. I don't know why they don't have gloves on, even if it's themselves, because they're infectious. Anyway, and this is just an example of the pattern that might develop of the vesicles. Okay, so we're also going to talk about pelvic inflammatory disease. And pelvic inflammatory disease can develop with untreated STIs. PID, or pelvic inflammatory disease, is just a generalization for any inflammatory disorder of the upper female genital tract. It occurs approximately 1% of women between the age of 15 and 39. There are usually about 1 million cases diagnosed every year. There is a the highest infection rate is among sexually active young women from the age of 15 to 24. There, again, I told you guys that about 1 million people are infected every year, diagnosed every year, and about 200,000 actually need to be hospitalized for it. So there are a few specific risk factors that we should talk about. Multiple sexual partners, if they've had PID before, early onset of sexual activity, if they've had a recent GYN procedure, or an IUD implantation. And some symptoms can include really severe bilateral sharp cramping pain. They might complain of a fever, purulent vaginal discharge. If they do have a fever, real quick, it's usually over 101, and they're also complaining of chills and other symptoms that go along with their fever. They might have some cervical tenderness, which obviously you're not going to know unless they're doing an internal exam on the patient. They might complain of motion tenderness during intercourse, malaise, nausea, vomiting. For the most part, people that develop PID are not having intercourse because they feel sick. We used to kind of joke a little bit, but when patients would come into the emergency department with PID, we actually called it the PID shuffle. And the way that they would present into the emergency department is they would actually be hunched over, grabbing their abdomen, and they would look sick. They really felt terrible, and again, had this horrible abdominal cramping pain. The diagnosis, again, is done through clinical examinations, the cultures that we talked about, because any of the methods of obtaining this infection can cause this. Again, it doesn't only have to be STIs. If someone had some type of gynecological procedure, they could develop this, or if they had an IUD put in, they can develop this. The treatment is going to be really important because if it's untreated, it can actually cause a lot of scarring and damage to the internal genitalia, and it can even be life-threatening in some situations if it's untreated. It's going to be very important to give patients IV fluids, pain meds, and antibiotics. Usually, they are given IV NPO antibiotics. Again, if they're able to tolerate PO fluids, that's great, but they might need to get IV hydration at least initially. Sometimes they're on bed rest or pelvic rest. They are often given Tylenol for fever and naproxen for pain. Their sexual partner needs to be treated for whatever infection they're diagnosed with. They are at a really high risk of becoming infertile. And so it's going to be very important for us not only to treat the patient, but also to determine what kind of infection they have so we can make appropriate nursing diagnoses and educate them to prevent this from happening in the future. Okay, the last thing that we're going to talk about is bacterial vaginosis, also called BV. Now, bacterial vaginosis is not actually considered an STD. It is more common in women that are sexually active, so that's why I included this here, because I don't know if you're going to get this information later. So bacterial vaginosis is the most prevalent vaginal infection in the U.S., both in sexually active and non-sexually active women. Usually men can... So anyway, what happens with bacterial vaginosis is there's an alteration in the normal flora of an alteration in the normal vaginal flora, and there's an overgrowth of a certain type of bacteria. There can be different contributing factors, but this is not always clear. Sometimes patients might tell you it's from sexual intercourse. Sometimes they might tell you it's from something they ate to alter the pH in their vagina. So, it can be very common for some women to develop this infection. And again, it's the most prevalent vaginal infection in the U.S. Some symptoms that women will complain of is excessive watery discharge, either white or gray. But the hint and the clincher is usually that they will say it's a foul, fishy odor. So the way that this is diagnosed is that they will actually take a sample during an exam, and they'll put it on a slide and look at it under the microscope. That's what it means on a wet mouth. That's what that means. Women who have this have an increased risk of PID. They might have abnormal PAPs. And pregnant women can actually be at risk for preterm labor because of this. So just really quickly, the treatment for this is, again, metronidazole or Flagyl or clindamycin. And this can either be given orally or intravaginally, both of them. All right, so this ends our STI lecture, and this is my last podcast for you for this class, but I hope you all do very well in your nursing career, and it has been a pleasure. So I'll see you guys in class.